The way you do this is you think of the scenarios, okay? Shockwave upsell scenarios. And there's about 5 right here. You've got 3 scenarios with maintenance patients and a couple with corrective care patients, okay? So maintenance patients, right? If you're a chiropractor that has a pretty decent PVA, patient visit average of at least 30 or higher, and I know some of your stats, I know all of your stats, some of you have like 40, 50, 60 PVA, that means you have a really good maintenance practice. That means you have good retention, patients love you, they love the care, so they keep coming back for more care, okay? These are all the patients that you can introduce shockwave to in a very ethical, classy manner, okay? So the first one is when you have a patient that has still some residual symptoms present, okay? They might be coming once a month for adjustment, and they're doing really well, or maybe every 2 weeks. But they still, you could tell, or they tell you that there's still a little bit going on of something, okay? Which you can upsell shockwave to. You can also, the easy one is when a maintenance patient says, hey doc, I got something new going on. Do you do anything about Achilles tendonitis? Yes, we do, with shockwave, right? Boom, right? Let's go test that, okay? And then, believe it or not, the patient who's just doing perfect, that never says anything is wrong, they're doing great. Oh no, I'm doing great, doc. Adjustments go like butter, right? You can still tell them about shockwave, and you actually might get an upsell out of it. I'm going to show you how to do that, okay? And then with corrective care patients, you might have a corrective care patient that you initially started on a course of care, maybe it didn't have shockwave, but you can always incorporate shockwave later if you've got an area that's not progressing, okay? And you need that extra push. And you can also, with a corrective care patient, maybe you recommend a 4 or 8, okay? They finish that, they might need or want more. Or now they're so convinced about shockwave and so, loving it, they might want to do it on a different body part, okay? So you don't just have to stop with your original recommendations.